Good morning. Chris Ohl, Infectious Diseases, Wake Forest Baptist Health. Here to talk about COVID. So it's summer. It really felt like summer yesterday. I spent some time at the pool, the neighborhood pool. It was a great experience. It felt good to actually feel like it's really summertime, a little bit of a vacation feeling to it. Everybody was personally distant and it wasn't crowded, about as safe as you could get it. It just goes to show you it can be done. So when you're out at the pool in the summertime, take a look at it before you go in. Is it crowded? Are people being distant? Are they doing what they're supposed to be doing to be safe at the swimming pool? So I was going to start out a little bit talking about our numbers here in the Triad region of North Carolina. We are one of the 16 or 17 states in the country where our case numbers are increasing. And we've talked a bit before, as the large urban areas numbers come down, there's been a shift in the more heavily impacted areas in the country to states that are more in the southeast, rural Midwestern states. And a lot of these have reflected that our numbers were really low for a very long time throughout May, and now that they're increasing some, it looks like we're having more, but in a large sense. But in reality, what we're doing is we're coming up to what we call to the mean. We're regressing to the mean, which means that we're becoming more average. But because we were low earlier, the numbers look a little bit more staggering. That's true throughout all of North Carolina. Our numbers very slowly are taking upwards. Some of this is a result of increased testing and increased penetration of testing, and people know that. It's a lot easier to go get a test now. Pharmacies are doing it, and some retail outlets will be doing it, in addition to the healthcare sites and to the drive-in testing sites that have been available to us up till now. We're also trying to increase testing, particularly in populations that have less access to health care, and that may be disproportionately affected by COVID. So we're opening a clinic between Novant and Wake Forest and the Public Health Department, all working together to get a clinic open on Highland Avenue in the eastern aspect of Winston-Salem. And the Health Department's talking about doing outreach in some of the eastern areas of our city with mobile moving testing centers, and look for that to come up in the next 3 to 4 weeks also. So as we do more tests, we're going to get more numbers. So here in the Triad, we're kind of stuck on our plateau of about 50 to 60 cases per day. Some people may have woken up on Monday and said, whoa, what's going on? We got 150 some cases in Forsyth County. That was a bit of an aberrancy because the numbers didn't get up into the state on Sunday. And so it would double the numbers were counted on Monday. So it really still was about the same as what we're usually seeing. And that double counting on Monday actually applied to a lot of other counties in North Carolina too. So it wasn't just Forsyth County, but it was a data aspect from the state. So no panicking that was necessary. We're still sitting right around 50 or 60 per day. Our percent positive tests, which is another measure that we use for activity, roughly is about the same as what it had been in the past, somewhere between 6 to 10%, depending on whether you're talking about people with symptoms or not. It hasn't changed. Our influenza-like activity, which is fever and a cough, in our emergency departments and clinics here in the area, has actually gone down a little bit. So overall, probably activity's about the same. There is one change, though, that I've noticed and in the last week or two, is whereas in the past month we've been dealing with clusters of cases that have been related to workplaces or families, and where a person tests positive, they say, yeah, I know where I got it. I got it from my sister. I got it from the place where I work, because there were sick people there too. But now we're starting to see some people who are testing positive who actually don't know where their contact was, which means that we're starting to see a little bit of community transmission that is not related to clusters. So a little bit in the background. It's not a large number. Most of our cases are still related to known clusters or known contacts. But we're starting to see a few now that where it's not been able to be identified. And what does that mean? It means we're going to have to be a little bit more careful in our communities about our activities. And we'll talk about some specifics about that in a minute. The other new development in the last week is now we've had a couple of cases in the state of the multi-system inflammatory syndrome, which is the Kawasaki's disease, or the inflammatory type syndrome that can be seen in children. And I believe both of the children are doing well, and they're hospitalized. But that's an update since last week. It would be expected to have a few small number of cases, and we've talked about before, it's a rare disorder. A few things new in science over this last week that's important to know. One is that we've made some advances on the vaccine front now, enough so that you probably saw in the national media that there were 5 companies that were chosen to be the major initiatives to produce vaccines here in the United States. Other countries are working on it too. It's not just us here in the US. And so those 5 candidates now will be the ones that move into what we call phase 3 trials, where we actually try to find out how well the vaccine works, how protective it is, and how safe it is in large numbers of people. So that's really good news. I think the vaccine development front's moving a little faster than what we originally expected it might. And maybe by this time next year, we'll see the light on the end of the tunnel about using vaccines, and rather than trying to talk about what we're talking about, of trying to make vaccines, we'll be talking about trying to deploy vaccines and how best to prioritize and who to give those to first, and how to get those out there. So that's really good news, and we can all feel good about that. The other thing that's come up in science in this last week is something that I've been cautioning people a little bit all along, is that this is the first time, COVID's really the first time, where our need for information and to do studies and publish studies and get it out is moving faster than what our usual peer review systems for making sure the data is accurate. And so over the last couple days, there are 2 major medical journals. You may not know the names, maybe not part of your bedtime reading, but the Lancet and the New England Journal of Medicine both issued cautions about studies that they published in the 3 weeks prior. And one of those was reflected by hydroxychloroquine, and that maybe the information that originally came out was that the drug was a lot more dangerous than what we originally thought, and that publication had the WHO stop their trial of hydroxychloroquine worldwide. Well, it looks now that the data that went into that paper may not have been totally accurate or analyzed correctly. And so the WHO restarted their trial because it probably inflated the adverse effects of hydroxychloroquine compared to its benefit. And then the other study in the New England Journal was reflected similar outcomes differences in COVID, and the data on that might have been analyzed improperly as well. So they're going back and re-looking at these. What does that mean? And why is this important? Well, I think it means that we need to be a little bit more cautious in publishing things and coming to conclusions very quickly. We're in a fast-moving world with our smartphones and with all the media, social media, and so on and so forth, and things get put out there really quickly. In science, we're used to being careful and looking at data, re-looking at data, and then peer reviewing it, which means give it to your colleague and see, hey, do you agree with my conclusion? What do you think? And I think those processes have been usurped a little bit with COVID, and we need to get back to being cautious before we start doing things. So when you see things that are out there in the media, science says this, science says this, science says this, look a little bit at the details and see, because they'll tell you, was this put out before peer review, when it was published? And does everyone really agree with it? And is it really a consensus in the world of science, so that we don't start jumping to conclusions that may not be warranted. Now, hydroxychloroquine is back in trials. My personal opinion, is that I don't think there's much benefit to it. We had a study come out this week that was done well, was peer-reviewed, and the data is robust, that says there's no benefit to taking hydroxychloroquine to prevent COVID, and that I believe. So I think that, hydroxychloroquine is probably not going to be an answer for us in treatment. But the bottom line is let's get the trials done correctly, let's analyze the data correctly, and then make the conclusions soundly before we start jumping to conclusions that may not be true. Another thing that's come out that I think is important was there's some analysis of some events involving super spreaders. Now, what is a super spreader? A super spreader is somebody who gets sick with COVID, usually very symptomatic, usually fairly symptomatic, and they shed a lot of virus. So if for those of you who remember Charles Schultz and Peanuts comic strip, or watch Charlie Brown at Christmas time, super spreader is, excuse me, I shouldn't have been eating peanuts before I came up here. Every now and then one drops down the wrong pipe. A super spreader is somebody who would be like Pigpen in the Charlie Brown comic strip, and just has really a lot of droplets that come from them. And when a super spreader gets into a large gathering of people, they can infect a lot of people. So we've seen some of these in the United States. There was the Gen X meeting up in Boston where 100 and some people were affected from one person. And in Hong Kong, they've identified quite a few super spreader events as well. And I'm personally aware of a few here in North Carolina. So when these super spreader events happen in these large gatherings, the people disseminate from that gathering and then go out into the world and to wherever they came from. So for instance, from that super spreader event, excuse me, at the Gen X meeting in Boston, we had people come down to the Triad area, or the Triangle area here in North Carolina. And that started the outbreak in that area that we saw way back in early March here. So when you have large gatherings of people and you get a super spreader in that gathering, it can disseminate the virus far and wide and create other new pockets or clusters of infection in other areas. So why is that? Why am I bringing this up as being important now? Well, they said it about 80% maybe of these early events here in the United States were a result of these large gatherings and super spreading. And so 80% of our cases in early March. So that's pretty significant. So I think as we move into the summer, we need to be really cognizant of these large gatherings and large crowds of people. And this has been in the news lately. So, Governor Cooper has been, a little bit hesitant about the Republican convention in Charlotte. Why? Large numbers of people, difficult to personally distance in a convention. And it could, if you have a super spreader in that event, not only could it spread into Charlotte through the hospitality industry, hotel workers and so on and so forth, but it also is going to go back to every state in the country. And it could be a way of really spreading virus. And so from a public health standpoint, just not a really good idea. And there may be a lot safer ways to do it than a conventional large gathering. The other thing that comes up, I've been asked a lot about lately, hey, Doc Ohl, what about it? My sister's supposed to get married. What do you think? Big wedding down in Wilmington, planned for July. And it's like, wow, 100 people at a wedding. First of all, right now we're still in sort of a modified phase 2, and we're not supposed to be having gatherings over 25 people. And then the other, would that really be smart? A smart thing to do, because if somebody was in that group, weddings are kind of intimate, they're close, people are close together. And it really could represent an event where a lot of people could get infected. So maybe best to still try to make a wedding smaller, more intimate, immediate family only, or postpone the party, postpone the reception for a year when you can really enjoy it and not have to worry about COVID at the same time. So, and family events, large gatherings, family reunions, big company picnics, so on and so forth. These are all large gatherings of people where spread could occur. Now, one thing that's been happening and is really a major development since last week is the number of protests that have occurred across the country, including here in the Triad, Winston-Salem, Greensboro. People are upset and really would like to see changes in how law enforcement approaches the aspects of race and ethnicity. And so there's a lot of protesting going on. Unfortunately, some of these have sometimes flame into riots. But for the most part, they're protests. But nevertheless, they're large gatherings of people. And while people have strong feelings and would like to vent and have these feelings brought out into the open, and I think it's important in a democracy to have these discourses. But it does represent a time where people could transmit infection from one to another. And somewhere in the United States, through some of these events, there will be transmission of COVID. So, if people feel the need and would like to go and be part of the community event in these discussions, by all means, make sure you wear a mask and keep your distance as best you can. And if for some reason you find yourself in an area with a lot of unmasked people and personal distancing isn't possible or isn't done, and it ends up feeling more like a large mass gathering, then go ahead and quarantine yourself for 14 days afterwards. And you can do that. Lay low, stay home, and try to limit your public exposures for the 14 days after the event to try to be a good citizen. If people were personally distanced, everyone was masked, it seemed like a safe thing. Use your good judgment. Maybe you don't have to do that. But but it's something to be aware of. And we would like for our expressions in such settings to be safe. One other thing I wanted to talk about are workplaces. So we're all, more and more people are going back to work. Restaurants are opening up. Kitchen staffs are coming into restaurants to serve food for us. Retail's opening up. Businesses that, maybe don't have public contact but are having their workers come back, starting to have meetings and such. In these workplaces, there's a few rules that are really, really important. And this includes the workplaces of healthcare, hospitals, clinics, nursing homes. And that if you're an employee in these places, number one, do not go to work when you're ill. And you may wake up in the morning and say, I just don't feel quite right. I don't know if I'm sick yet, but I don't feel quite right. Maybe it's allergies, maybe it's just a bad day, maybe I didn't sleep so well, but it's just I don't feel that well this morning. Call in and don't go to work, because it is much better for you to not be there than for your illness to progress while you're at work and then you expose other employees. So this is really, really important, particularly for employees in healthcare. Again, nursing homes, healthcare clinics, and hospitals. If you think you're sick, call in sick, please. It's much better for everyone in the long run. And then if you do get a progression of your symptoms, then talk it over with your healthcare providers or your employee health, so on and so forth, and see if you should get tested. The second thing in workplaces is that you still, even though it's a workplace and you know all these people, you still need to try to personally distance as best you can and wear a mask. And some places it's a little bit harder to do this. If you're in a restaurant, in a kitchen for instance, it can be small, but you got to make sure you wear your masks. If you're in a conference room or in a workroom, wear your mask. And we need to make sure we're doing this in our workplaces, just like we do in the grocery stores. Lastly, we have to understand just about every workplace, as we go through the next few months, we'll probably have an employee test positive. A lot of people are getting tested. There's enough COVID out there now. And so we have to understand that that's just going to be part of living with the virus as we move forward. And that doesn't mean that the workplace is, or that restaurant or that retail store is doing something wrong or that they're not sanitary. It just means that an employee tested positive. And there's a lot of things that we can do to keep it from spreading in those situations. And it's going to happen to everyone at some point in the next year. So we just have to, realize we're living with the virus, and that as we go back to work, workplaces are going to be affected too. So it's just part of being in a pandemic. Another thing I wanted to talk a little bit about was testing again. So I've been asked a lot of times now, I'm a contact of a case, should I be tested? Or I want to get tested, I'm a contact. Well, you need to realize that if you're a contact of a known case and you've been told you're a contact, that means within 6 feet for at least 15 minutes, and both of you are unmasked, then that means that you're going to be quarantining for 14 days. If you go and get tested and your test is positive, then it just means that you're now a case and not a contact. And you're going to be isolated now for at least 10 days after that test is positive, even if you're asymptomatic. And then if the test is negative, you're still in quarantine. So the test really didn't change a lot for you because you're still going to have to either isolate or quarantine. If you have symptoms and you're a contact, yes, by all means, then get tested. It helps us in healthcare to know what the diagnosis is for you. But if you're not symptomatic, either way, and you're a real contact, you're going to have to quarantine for 14 days or be isolated if you did get tested. So the test doesn't really change the outcome for you. I want to make sure that's really clear for people because there's been a lot of confusion about that. I think that sometimes people think that testing is going to fix everything with COVID, and it won't. A test just tells you whether you have it right now. It doesn't tell you whether you're going to get it in 5 days. It doesn't tell you whether you're going to get it in a month. Testing isn't the end all, but it does help us in public health to isolate and quarantine, and that's why it's important. So we'll see what happens with mass testing. I don't think that it's going to be recommended for doing huge populations and prevalence type settings, but we'll see how that goes through the summer as our testing capacity goes up. So I think that's what I mostly wanted to talk about this morning, and I'll just open it up if there's any questions.
Can you talk about, with all these protests going on, I mean, police are sometimes using tear gas and pepper spray. Can you speak to, for somebody that's in like the crowd being affected by pepper spray and stuff, how to deal with that, both rendering first aid to someone else or yourself? I mean, because obviously with all the coughing and bodily fluids and stuff, that makes the virus spread.
Yeah, so there are concerns about using tear gas and pepper spray is a tear gas. It is classified as one. So we'll just talk about tear gas. About using tear gases in protests. So the tear gases do a lot of things. It increases tears by its name. And the more tears you have, if you have a virus in and around your eyes, then the virus gets into that little duct at the side of your eye and gets into your nose. So if you've been exposed to COVID and you start tearing a lot, your odds of getting it are going to be higher. The other thing is, as you mentioned, there's a lot of coughing and gagging, and that increases the amount of respiratory droplets that go out into the world. So yes, there is some concern that the use of tear drops or tear gases will increase the transmission of COVID if there are infected people present in the gassed area. So how do you deal with it? Well, the first aid for tear gassing is basically, one, get yourself out of the tear gas area and remove the exposure, and then it's copious amounts of water in and around the eyes and the face and the mouth, and you just wash it out. And that's the best first aid. So you can help other people do it, but if you're helping somebody and providing first aid to them, then you keep your mask on and then wash them off. I mean, it's still best to try to help other people. I would not be paralyzed by fear that they might have COVID and tear gas. We need to help other people who have been exposed. But you can also do it to yourself, and it can be done. And the bottles of water that are plastic work kind of well because you can squeeze them and you get a kind of a forceful amount of water out and into your eyes. So that's what I would recommend. Other questions? Any questions from our Facebook crowd out there? No? All right, so with that, next week, Dr. Ohl is going to try to go on vacation. So I won't be here for Thursday for our standard briefing. But I do plan on coming back on the Thursday afterwards. So save up your questions next week and bring them to the forefront and bring them out, and we can talk about them the week afterwards. And hopefully everyone will have a safe and somewhat restful week as we're in the summertime now. And so I look forward to seeing you in 2 weeks.